Ladies and gentlemen, the state is not a better provider of healthcare than the private sector and never will be, because both are equally bad. They both have a fundamental weakness. They are easily corrupted. The state is corrupted by power and the private sector is corrupted by money. If the state has a monopoly of healthcare, bureaucracy will proliferate and there is no financial incentive to treat patients well. Patients become mere statistics and simply the way in which bureaucrats and politicians further their careers. For doctors and nurses working in large, impersonal organizations become alienated and inefficient. In the private sector, however, the patients are a source of profit and unnecessary expensive treatments proliferate for those patients with money, and people without money have no treatment. This fundamental weakness, ladies and gentlemen, arises because when we are ill, when we are patients, we are weak and vulnerable and rarely know what is best for us, since medicine is so complex and we are so desperate to live. Sick patients are not like healthy shoppers in the market who can make their own judgments about what they buy. When we are ill, we are easily exploited. This is one of the reasons why most modern economies have both state and private healthcare systems running in parallel. In an ideal world, the state guarantees a basic level of healthcare for everybody, irrespective of their income and social class, and also regulates healthcare in both private and public sectors via the rule of law, so the patients are not exploited. In an ideal world, the private sector provides healthcare which is economically efficient and competitive and gives patients more choice. But of course, we do not live in an ideal world. There are many different ways of combining state and private healthcare systems, and there are increasing experiments in so-called private-public partnership. In France and Germany, the state provides universal health insurance, which patients can then use in either public or private hospitals. In Britain, the state provides all healthcare free of charge in public hospitals, but 12% of the population have additional private healthcare insurance, which they can then use for private treatment in either state or private hospitals. In China, there is no state provision of healthcare at all, a major reason why the Chinese, in case they fall ill, save so much money, and hence at the same time finance the massive American trade deficit with China. In Scandinavia, almost all healthcare is provided by the state, and the private sector is very small. In other countries, such as Greece and Ukraine, the distinction between the private and public sectors is not clear, since patients must pay doctors privately, under the table, even though they're being treated in public hospitals. I've been visiting Ukraine and working with medical colleagues here now for almost 20 years. I've come to have a great affection for your country, and you have many things of which to be proud, but as you all know, your healthcare system is not one of them. It was a product of the monolithic Soviet state, where the state had a monopoly of healthcare, and the consequences of this were not good. We all know that these bad consequences are partly because the Soviet Union preferred to spend its money on guns and rockets and exciting things like that, rather than on healthcare. But the monolithic Soviet state also produced a medical profession that was as rigidly hierarchical as the political elite, and change and progress were discouraged. Western medicine raced ahead away from Soviet medicine, not just because more money was spent on healthcare, but also because constant innovation and change was welcomed. And most importantly, true science was used to decide whether new treatments and technologies really helped patients or not. I spoke earlier of the importance of the rule of law. Equally important is the application of what is called evidence-based medicine. In Ukraine, I constantly see patients receiving expensive drugs and operations that have been proved elsewhere to be completely useless. Ladies and gentlemen, if healthcare is to improve in Ukraine, you need a system that supports both public and private sectors. But for this to be successful, there are some very difficult problems to be solved. Firstly, you need to find a way of paying for it. Modern healthcare is very, very expensive. In a country where many people are poor and everybody distrusts the state and are deeply reluctant to pay tax, this is no easy task. Secondly, you need the rule of law with an independent judiciary, so that the healthcare system, whether public or private, can be properly regulated and patients protected from corrupt bureaucrats and greedy doctors. Thirdly, your doctors need to compete and cooperate on the basis of evidence-based medicine, In other words, on the basis of honesty and not on the basis of politics and jealousy. Ukraine is a young country. Out of little acorns, great oak trees can grow. But if you want a better healthcare system, you must escape the past and the mistaken idea that the state is a better provider of healthcare than the private sector. You need both properly regulated. Ladies and gentlemen, I would ask you to oppose this motion. Thank you.